Welcome to Raaonline. Today's topic is maternal safety bundle for sepsis. So, maternal sepsis is a life-threatening condition. It is defined as organ dysfunction resulting from infection during pregnancy, childbirth, or the postpartum or the post-abortion period. Epidemiology. Global prevalence of sepsis is 4.4% among live births. 11%. 22.5 to 23% of maternal death is because of maternal sepsis. So, maternal sepsis is the third most common direct cause. The first is hemorrhage, second is preeclampsia, and third is maternal sepsis. So, maternal mortality is directly affected by maternal sepsis. Maternal sepsis is responsible for 260,000 maternal deaths per year. 5% in developed countries death is because of the maternal infection, and 11% of maternal deaths in low middle income countries is because of maternal infection. 9.7% of maternal deaths in Asia is because of infection. 11.6% of maternal deaths in Africa is because of maternal infection, and 7.7% of maternal deaths are due to infection in Latin America. So, all over the world, maternal sepsis accounts for a huge chunk of maternal deaths. Now, fatality of puerperal infection is in low middle income countries is 50%, though this is much lesser in our setup. So, if a lady gets infected in her puerperal period, that has to be taken as very seriously. In the older days, it used to be called as childbed fever, and it was effectively treated by Semmelweis. Now, if we fail to recognize sepsis early, then it is very difficult to prevent maternal mortality. So, to prevent maternal mortality, we should make sure that we recognize early signs of sepsis. Now, what are the timings a mother can get infected? She can get before labor, during labor, or after labor. When it is before labor, it is called antepartum. During labor, sepsis is called intrapartum sepsis. After labor, sepsis is called as postpartum sepsis. Now, clinical presentations can occur in various systems. Now, maternal sepsis can result in intraamniotic infections causing premature rupture of membranes, stillbirths, neurodevelopmental delay, early or late onset sepsis, and it can also cause perinatal death in the newborn. What is the effect of pregnancy on sepsis? So, during pregnancy, there is an increased risk of infection. There is an increased risk of surgical infection because now she is visiting the hospitals and she is also at a chance for getting cesarean or an instrumental delivery. So, there is a high risk for surgical infection, and there is an overlap between normal changes of pregnancy and clinical manifestation of sepsis like tachycardia, flushing, low blood pressure. So, sometimes it becomes very difficult to identify sepsis in pregnancy. What are the causes of maternal sepsis? We can divide them into obstetrical causes and non-obstetrical causes. So, obstetrical causes of maternal sepsis include chorioamnitis, endometritis, septic abortion, wound infection after cesarean section, and obstetrical hemorrhage or amniotic fluid or air embolism. AFLP, which is also called as acute fatty liver of pregnancy, that is also associated with maternal infections. Non-obstetrical causes of infections include pyelonephritis, pneumonia, and COVID in pregnancy. What are the risk factors? Which women are likely to get maternal sepsis? If the patient has a previous history of GBS or a pelvic infection, if the patient has a history of contact with other group A streptococci, if the patient has got her labor induced and she has been in hospital, people doing multiple pervaginal examinations, if there are invasive procedures like cesarean and forceps and ventouse applied on her, she is at risk factor for maternal sepsis. Premature rupture of membranes is a risk factor for maternal sepsis. Instrumentation or LSCS, if associated with maternal sepsis, carries a very high mortality. Mastitis or breast infection, preeclampsia is also predisposing factor for maternal sepsis. Multiple pregnancies, postpartum hemorrhage also makes them a high risk for maternal sepsis. Presence of retained products of conception act as a nidus for intrauterine endometritis and deciduoiditis. Primary disparity. Anemic women are more prone for infection. Hypertension and diabetes in pregnancy. Hyposplenia or history of splenectomy done predisposes them to infection. Immunosuppression as in HIV/AIDS. Febrile illnesses concurrent in pregnancies. Recent antibiotic use also predisposes them to infection. Obesity, poverty and poor nutrition, and the list goes on of who all are at risk factor for sepsis. So when we come to the microorganism responsible for the maternal sepsis, we realize that the commonest organism is E. coli, Escherichia coli. The second commonest is Clostridium tetani, and then there is also other microorganisms like Klebsiella, Acinetobacter, Enterobacter, Bacteroides, Proteus mirabilis, Pseudomonas, other gram-negative bacteria. There is Streptococcus infection, Staphylococcus infection in pregnancy, Enterococcus in pregnancy, Listeria monocytogenes in pregnancy, other gram-positive bacteria, other anaerobics, and other non-bacteria also have got infections in pregnancy. So we need to culture and do the antibiotic sensitivity before starting treating the maternal sepsis.